What are biopsy types for lymphoma diagnosis? Imagine trying to solve a mystery about a swelling or unusual lump in your body. Doctors need to look at tissue samples to find out if it's lymphoma, a type of blood cancer affecting lymph nodes. There are several ways to get these tissue samples, each suited for different situations. The most thorough method is the excisional biopsy. This involves surgically removing an entire lymph node or a large part of it. It provides a big piece of tissue, which helps pathologists see the full picture and accurately identify the type of lymphoma. Usually, this is done under local or general anesthesia, depending on where the lymph node is located. It's especially useful when doctors suspect Hodgkin lymphoma or when other biopsy methods don't give clear results. If removing the whole lymph node isn't safe or possible, doctors might choose an incisional biopsy. This means taking out just a part of the lymph node or tumor. It still provides enough tissue for diagnosis but is less invasive than removing the entire node. For a less invasive option, core needle biopsy is often used. This technique involves inserting a larger needle to extract a small cylinder of tissue from the lymph node. It's usually guided by imaging like ultrasound or CT scans, especially if the lymph node is deep inside the body. Core needle biopsy is common for suspected non-Hodgkin lymphoma because it can give enough tissue for testing without surgery. Sometimes, if the sample isn't enough, a follow-up surgical biopsy might be needed. Another method is fine needle aspiration, which uses a very thin needle to draw out cells from the lymph node. While it's quick and minimally invasive, it only collects scattered cells and doesn't preserve the tissue structure. This makes it less reliable for diagnosing or classifying lymphoma, especially Hodgkin lymphoma. It's rarely used alone for diagnosis but can be helpful in certain situations. Besides lymph nodes, doctors may perform a bone marrow aspiration and biopsy. This isn't for initial diagnosis but to see if the lymphoma has spread to the bone marrow, which helps in staging the disease and planning treatment. In some cases, doctors might do a lumbar puncture, also called a spinal tap, to check for lymphoma involvement in the cerebrospinal fluid. But this isn't a primary biopsy method for lymphoma. The choice of biopsy depends on where the suspected lymphoma is, how accessible the lymph nodes are, and how much tissue is needed for accurate diagnosis. Excisional biopsy remains the best option for initial diagnosis, especially for Hodgkin lymphoma, because it provides the most tissue. Core needle biopsy is often used for non-Hodgkin lymphoma because it's less invasive and still effective when combined with advanced lab tests. Fine needle aspiration is rarely enough on its own but can be useful in specific cases. Bone marrow biopsy is mainly for staging, not initial diagnosis. Once the tissue is collected, it undergoes detailed examination using techniques like immunohistochemistry and flow cytometry to confirm if lymphoma is present and to determine its subtype. Always remember, your healthcare team will choose the best biopsy method based on your individual situation, so it's important to discuss any questions or concerns with your doctor.